What is the process to report Medicare fraud? If you suspect Medicare fraud, you might be wondering how to report it. This is an important step to protect yourself and others. Let's break down the process into clear steps. First, take a close look at your Medicare Summary Notice or explanation of benefits. Check for any charges or services that seem incorrect or suspicious. This is your first line of defense. If you find something that raises a red flag, the next step is to reach out to the provider or plan directly. Ask them to clarify the questionable charges. Sometimes, these issues can be resolved quickly with a simple conversation. However, if you are not comfortable contacting them or if you are not satisfied with their response, there are other options available. You can contact your local Senior Medicare Patrol. These volunteers are trained to help identify and report Medicare fraud, abuse, and errors. They can provide guidance on what to do next and help you refer your complaint to the right authorities. If you still feel that fraud is occurring, it is time to report it through official channels. You can call one of the following numbers: 1-800-MEDICARE, which is 1-800-633 for 1,227, to report fraud and ask any questions you may have. You can also reach out to the Health and Human Services Office of Inspector General Fraud Hotline at 1-800-HHS-TIPS, which is 1,800 for 147 8,000 for 177. Another option is to file a complaint online at the Office of Inspector General website. If you have a Medicare Advantage or Part D drug plan, you can call the Investigations Medicare Drug Integrity Contractor at 1,877 7 SAFERX, which is 1,877 770 to 3,379. Be cautious when sharing personal information. Never give out your Medicare number or Social Security number unless you are sure of who you are speaking with. Medicare will not call you to ask for this information without you initiating the contact. It is also a good practice to keep copies of all your receipts, bills, and Medicare notices. Regularly reviewing these documents can help you spot any fraud early on. If you prefer to report suspected fraud by mail or fax, you can do that too. Fax reports can be up to 10 pages long, and if you choose to mail your report, address it to the Office of Inspector General in Washington, District of Columbia. Reporting fraud is essential for maintaining the integrity of the Medicare program. It ensures that funds are used appropriately to provide care for beneficiaries. Medicare encourages everyone, including beneficiaries, caregivers, and the public, to be vigilant and report any suspected fraud promptly. By following these steps, you can help Medicare combat fraud and protect access to necessary health care services.